When your heart stops beating, it is a mad rush for paramedics to do what they can to keep you alive. New on Daybreak, ABC 15's Hatzel Vela shows you the extra measure an East Valley Fire Department is taking to make sure not only you survive, but also recover quickly.
When the heart stops beating, the blood stops flowing, and so does the oxygen. Rescue workers want to get a pulse going and blood pressure back to normal. But they also want to slow down the spread of what they call byproducts, which can flow into the brain and cause long-term damage. They do this by starting therapeutic hypothermia, or cooling down of the body.
We start with the cold fluids because that gives us a head start on the hypothermia process.
IV fluids kept at 38 degrees and ice packs are quickly used on the patients.
We're putting them where there's major blood vessels. You have the femoral arteries, you have the carotid jugulars, you have the brachial. Big arteries are exposed to this cold, and that will help cool the blood a little quicker.
Cooling of the body started in the field but then continued at the hospital, typically 48 hours after a patient arrives for treatment. Mesa Fire paramedics have been doing this for 8 months. They're one of few Valley Fire Departments using this approach that is now being recommended by the American Heart Association because of its results.
The people that it's used on have a much greater recovery of brain function than what we were used to seeing before.
Keeping someone alive is always the goal, but beyond bringing them back to life, making sure they don't have long-term damage to the brain is the new challenge for paramedics. In Mesa, Hatzel, Vela, ABC 15 News.
Firefighters say CPR is still critical in the process. What they call hands-only CPR can triple a victim's chances of survival.